Hello, everyone, and welcome to this lecture on pharmacokinetics and pharmacodynamics. As paramedics, it's essential that we have a strong understanding of these two concepts in order to provide safe and effective patient care. Pharmacokinetics, or PK, deals with how a drug enters the body, how it's distributed throughout the body, how it's metabolized, and how it's excreted. Understanding PK allows us to predict how a patient's body will handle a drug and determine the best dose to achieve the desired effect. Pharmacodynamics, or PD for short, deals with how a drug affects the body. It looks at the interactions between drugs and receptors in the body, the dose-response relationship, and the potential for side effects. Understanding PD helps us anticipate potential side effects of a drug and monitor the patient for them. Together, PK and PD form the foundation of pharmacology, and it's essential that we have a deep understanding of these concepts in order to provide safe and effective patient care. By understanding PK and PD, we can individualize treatment based on a patient's unique characteristics, medical history, and optimize the therapeutic effect. So today we'll be diving deep into these concepts and providing you with the knowledge and skills necessary to apply PK and PD principles into your practice. So let's get started. The learning objectives will be to describe mechanisms of drug action and list and differentiate the phases of drug activity, which include pharmacokinetic and pharmacodynamic phases. To use an analogy, pharmacokinetics is like a package delivery service. The package, or drug, is delivered to the body, which is the destination, by various means. The various means, for example, absorption. It's delivered to different parts of the body, so now we're thinking distribution. It's processed and sorted, now we're looking at metabolism. And finally, it's removed from the body. Let's think here, excretion. Pharmacokinetics, if we define it, is the study of movement of drugs within the body, including how it's absorbed, distributed, metabolized, and excreted. It focuses on the processes that affect the concentration of drugs in the body over time. So again, it includes these concepts that we have listed here. Absorption, which refers to the process by which drugs enter the bloodstream from the site of administration. Distribution, which refers to the process by which drugs are transported throughout the body via the bloodstream. Metabolism, which refers to the process by which drugs are broken down in the body. Excretion, which refers to the process by which drugs are removed from the body. Factors that can affect PK include age, gender, disease states, genetics, and drug interactions. It helps to understand how drugs work in the body, how long it takes for the drugs to reach their target site, how long the drugs stay in the body, and how the body gets rid of the drugs. Because once we understand PK, it helps to predict the drug's behavior in the body, and then we can adjust the dose, frequency, and the route of administration to achieve optimal therapeutic effects with minimal toxicity, which is our goal. Now, this is an enzyme group that you will hear and read a lot about, so it's important to have a general understanding of what it or they are. So this CYP450 enzyme is actually a group of enzymes found in the liver that are responsible for breaking down, or again, metabolizing, certain drugs and other chemicals in the body. These enzymes work by attaching themselves to the drug molecules and chemically altering them, which makes them less active or more easily excreted from the body. If we look at an example of how this enzyme works, if we look at warfarin, which is used to prevent clots, warfarin is metabolized by the CYP450 enzyme, which is called, it's another number, CYP2C9. Okay, it's not important to memorize that, just to understand that CYP450 is a group of enzymes, and within those enzymes, one of them is CYP2C9. So some people have variations of this type of gene, the CYP2C9 gene, that makes their enzymes less active, which then results in higher levels of warfarin in the blood and puts the patient at increased risk of bleeding. Therefore, people with this gene variation may require a lower dose of warfarin. Additionally, other drugs that are metabolized by the same enzyme, here we're looking at aspirin, which is a medication that we give, ibuprofen, which is a medication we will most likely give in the future, or diclofenac. may interact with warfarin and then increase the risk of bleeding further. Another concept that's really important to understand is the first pass effect. So first pass metabolism, which we also call first pass effect, or we also call it the pre-systemic metabolism, is a process that occurs when a drug is administered orally, so through the mouth, and is metabolized by the liver before it reaches the rest of the body. So the first pass meaning it has got to go past through the liver first. This process can greatly reduce the bioavailability of the drug and make it less effective. The liver and gut wall are the primary systems that affect the first pass effect of this drug, or of any drugs that are ingested orally. This is why some drugs are not administered orally, certain antiviral medications, because it would be metabolized in the liver and not reach the rest of the body, because the liver would do such a good job at metabolizing it, and then we would just excrete it. Other routes of administration, like intravenous, so IV, inhalation, and sublingual, can avoid the first pass effect. So inhalation, we're thinking here that we give the medication Ventolin, or sublingual, we give the medication nitroglycerin. The bioavailability of the drug can be affected by several factors. We're talking about here the drug's solubility, lipophilicity. Okay, so this is the drug's ability to break down in fat, so it's fat soluble, and the presence of food in the GI tract, gastrointestinal tract. The bioavailability of many drugs is increased in patients with compromised liver function, or if another drug competing for the first pass metabolism enzyme is given concurrently. So let me repeat that. The bioavailability of many drugs is increased in patients who have compromised liver function, so somebody who has liver cirrhosis or any type of liver disease where their liver is not properly functioning, well, that will actually increase the bioavailability of the medication they take. Or in the second instance is where there's two medications that are given at the same time and they're competing for that first pass metabolism. Unfortunately, this is one of those things that we need to take into consideration, where if we're giving two of these medications at the same time, well, one will not be metabolized as efficiently by the liver and by those enzymes. So there may be increased bioavailability of medication. Here's an interesting diagram where it shows a mnemonic of drugs with high first pass metabolism. For example, nitrates, like our medication nitro, which is why we give it sublingually. In here we also have salbutamol, which is why we give it via inhalation. So I've said bioavailability a few times now. Bioavailability is a term used to describe the amount of a drug that reaches the systemic circulation and is available to produce a therapeutic effect after administration, which is our goal. So we're giving this medication. We know that it's going to be metabolized by the liver before even reaching the site of action where you want it to have an impact. So we want to make sure that we give the correct dose so that once it passes through the first pass liver, that we still have enough medication to have an effect. Or again, we want a therapeutic effect. So this bioavailability is expressed as a percentage of the administered dose. To explain bioavailability, let's go back to our analogy of packages. So imagine a drug as a package that needs to be delivered to a specific destination, a specific part in the body. The bioavailability of a drug is the percentage of the package that is delivered and reaches the destination, the specific part in the body. And the medication or the package is intact. So a drug with a high bioavailability means that the most of the package is delivered to the destination, while a drug with a low bioavailability means that only a small percentage of the package reaches the destination. This concept is important for us as paramedics to understand because it can affect the effectiveness of a drug and the dose required for a therapeutic effect. When we talk about therapeutic effect or therapeutic action, this refers to the specific biological effect of a drug that is responsible for its therapeutic benefits. It's the desired outcome or impact of the drug on the body. This includes things like reducing pain, reducing blood pressure, fighting off an infection, and so on and so forth. It's the main reason why the drug is actually administered. Each drug has a specific mechanism of action, which is the series of chemical reactions that take place in the body when the drug is administered and produces its therapeutic effects. Understanding the therapeutic action of a drug is crucial for paramedics because it helps them to choose the appropriate drug and dose for a patient's condition, as well as monitor for the potential side effects. Now let's discuss pharmacodynamics. To use an analogy to explain pharmacodynamics, or as we mentioned before, PD, pharmacodynamics is like a lock and key. So the drug, which is the key, fits into specific receptors, which are the locks on cells in the body, and this triggers a response. So imagine unlocking and opening the door. Some drugs or keys fit perfectly, which we call these agonists. Okay, the keys that fit perfectly into the receptor, we call this an agonist. And some drugs, other keys, block the response, and we call these antagonists. So the antagonist binds to the same receptors and blocks a response. So here, for example, one of the medications that we give to block a response, we give Narcan, which competes for the same receptor sites as an opiate. So we give Narcan to counter the effects of opiate. Again, this is specifically not necessarily for a level of orientation, but more for respiratory drive. So the number of receptors, again, the receptors being visually thinking the locks, and the sensitivity of these receptors, again, the locks, can affect the response. And the response here being the door opening. So pharmacodynamics, if we define it, is the study of the biochemical and physiologic effects of drugs on the body and the mechanisms by which those effects are produced. It focuses on how drugs interact with specific receptors in the body to produce a biological response or therapeutic action. Now, PD includes the following concepts. First being receptor theory, which explains how drugs bind to specific receptors, as we were talking about before, in the body to produce a biological response. Agonists and antagonists, which are drugs that bind to these receptors, and then they either stimulate or inhibit them, respectively. Dose relationship or dose response relationship, which refers to the relationship between the dose of a drug and the magnitude of the response. Factors that can affect PD include genetics, drug interactions, and disease states. And it explains how a drug produces its effects, how much of the drug is needed to produce a certain effect, and how long the effects last. By understanding PD, it helps to predict a drug's behavior in the body and to adjust the dose, frequency, and the route of administration to achieve optimal therapeutic effect, again with minimal toxicity. As mentioned in previous lectures, every drug has the opportunity or has the capabilities to be toxic, including something such as where you would think so benign as oxygen. So understanding the PD of a drug can also help in the identification of potential side effects so we can be ready for them, so we can manage them, and we can manage any interactions. As paramedics, it's important to understand how to apply the principles of PK and PD to the real world and to patient care. So first, let's talk about determining appropriate dosing. By understanding the pharmacokinetics of a drug, we can predict how the body will handle it and determine the best dose to achieve the desired effect. This includes considering factors such as the patient's age, weight, and any underlying medical conditions that may affect the absorption, the distribution, metabolism, and excretion of the drug. Next, we need to be aware of the potential of adverse effects of a drug. By understanding the pharmacodynamics of a drug, we can anticipate the potential side effects and monitor the patient for them. This includes understanding the drug's receptor binding and the potential for interactions with other medications the patient may be taking. Finally, we can individualize treatment based on PK/PD principles. By understanding a patient's unique characteristics and medical history, we can adjust the dose and choice of drugs to best meet their needs and optimize the therapeutic effect. So let's look at some case studies to understand this further. The first one is a 65-year-old female with hypertension, so high blood pressure, and chronic kidney disease. Patient presents with chest pain and is given aspirin for potential acute coronary syndrome. So if we look at the pharmacokinetics As aspirin has a low oral bioavailability, a high dose of aspirin is needed to achieve the therapeutic effect. So that's why you'll see when you're giving aspirin, you're giving a pretty high dose because of its low oral bioavailability. The patient's age and chronic kidney disease may affect the metabolism and excretion of aspirin, again, because the kidneys aren't properly functioning, leading to a longer half-life and increased risk of bleeding. Because again, that medication, the aspirin, is not being secreted as fast as you would expect in a healthy individual. If we look at pharmacodynamics, aspirin's mechanism of action is to inhibit the formation of something called thromboxane, which is a substance that promotes platelet aggregation and blood clotting. So platelet aggregation, essentially the platelets being attracted to one another and forming a clot. The patient's history of hypertension may increase the risk of bleeding, as hypertension may promote the formation of fragile blood vessels. So in this scenario, we as paramedics must take into account the patient's medical history to minimize the risk of bleeding and to achieve the desired therapeutic effect. Again, we are always looking at risk benefit when we're working in healthcare. So a second case study, 25-year-old male with no known medical history, so healthy. Patient presents with shortness of breath and is given salbutamol for bronchospasm. Okay, so just a narrowing of the patient's airway. If we look at the pharmacokinetics of salbutamol, which is another medication that we give, salbutamol is quickly and almost completely absorbed after inhalation. So it has high bioavailability, reaching peak plasma concentration within minutes. Okay, so you can start to understand why it's important to understand this, because not only do we know that, okay, we're giving 5 milligrams of a medication, well, we can know that almost close to 100%. Again, I'm just talking in theory. I don't have the actual number of bioavailability, but most of the drug is making it, versus our other scenario where aspirin is given orally. It's going through first pass effect, first pass metabolism through the liver. Well, only a small percentage of that aspirin is actually reaching the end organ, essentially, the target cells where they have to have an impact. Salbutamol is rapidly metabolized and excreted by the body, which has a half-life of about 2.5 hours. It's also important to understand here in terms of the pharmacokinetics, well, how long will that medication have an impact for? Because then we know when to give our next dose if inclusion criteria are still present. So in line with pharmacodynamics, salbutamol binds to what we call a beta, it's a beta-2 adrenergic receptor. It binds to these receptors in the lungs, which leads to relaxation of the bronchial smooth muscle, which then increases airflow and reduces bronchospasm, which is exactly what we want it to do. For instance, somebody who is having an asthma attack. But salbutamol doesn't just act on the beta-2 adrenergic receptors, it acts also on, it has effects on beta-1. Beta-1 is found, the receptor sites are on the heart. So it's no surprise that salbutamol will also cause tachycardia, or a fast heartbeat. Another side effect, or common side effect of salbutamol, is a tremor. So feeling anxious, feeling a tremor, shaking a little bit. So it's important for us, by understanding these pharmacodynamics of this medication, that we can understand the potential side effects and repeat the dose of salbutamol as needed to maintain relief of bronchospasm. Again, it's always a question of risk-benefit. Yes, it will increase tachycardia, increase tremors. We have a perfectly healthy individual here. We're not too concerned about continuing to give salbutamol. Now, on the contrary, if you're thinking about somebody who is extremely, extremely sick, has congestive heart failure, who's had 5 heart attacks in the past, open heart surgery, stents, what have you, well, maybe now we're going to be a little bit more weary when we're giving lots of salbutamol, because we are concerned about the increases, let's just say, in blood pressure and increases in heart rate. So in this lecture, we've discussed the important concepts of pharmacokinetics and pharmacodynamics. We've talked about how drugs are absorbed, distributed, metabolized, and excreted in the body, and how these processes can affect the effectiveness of a drug. We also discussed the first pass metabolism, which is a process that occurs when a drug is metabolized by the liver before it reaches the rest of the body. We've also explained how drugs interact with receptors in the body and how this interaction leads to biological response, or what we call the therapeutic action of the drug. We also covered the importance of understanding the bioavailability of a drug, which refers to the amount of a drug that reaches the systemic circulation and is available to produce a therapeutic effect. We also discuss how certain factors such as genetics, disease states, and drug interactions can affect the pharmacokinetics and pharmacodynamics of a drug. It's important for us as paramedics to understand these concepts as it helps us to choose the appropriate drug and dose for a patient's condition, as well as monitor for potential side effects. We also discuss alternative routes of administration that can bypass the first pass effect and how they allow drugs to be absorbed differently into the systemic circulation. We also highlighted the importance of understanding the therapeutic action of a drug and how it helps to choose the appropriate drug and dose for a patient's condition. So overall, pharmacokinetics and pharmacodynamics are important foundational concepts that help us as paramedics understand how drugs work in the body and how to use this knowledge to provide safe and effective care to our patients.